Hello there, I'm Jenna Finelli, and this is Google Translate Does Your Neuro Exam. Because Google is the best medicine. You ask Google for advice on pretty much everything you do. Why not let Google do your medical exam? And because nowadays, everyone should be involved in your healthcare, not just you and your doctor, but also the government and everybody else, including every single health insurance company and administrators and billing. Everybody else knows better than your doctor how to take care of you. So, what I did was I figured, let's get everyone in the world involved in your healthcare, and I took the actual neuro exam that I, as an actual physician, with my license numbers in the description below, would do, and I ran it through Google Translate through many, many different languages so that everyone else in the world can get involved in your healthcare and let you know. And this will be good. This will be great. So we've already done a heart exam and ear exam. I think our ear exam went really well, right? Do you still have blue goo draining out of your ears? No? Excellent. So we're going to do a neuro exam. First step, and the observer does not move or stop. So do not move, and also do not stop moving. You're stopping now. No, now you're moving. No, you have to do neither. Look, all you have to do is embody Heisenberg's uncertainty principle, just like the cat in Schrödinger's box. That's all I'm asking of you. You're not doing a very good job. Maybe if we do a little bit of math, it'll help you out. We'll do a little bit of, what happened to my pen? Did you take my pen? Or is my pen both moving and stopping now? You definitely stole my pen. Why did you do that? That's okay. This is the same thing. I'll just carve my notes on your arm. No, that's not in the Google Translate. I'll just scratch them on here. It's just fine. Alright, so the observer does not move or stop. Let's do a little bit of quantum physics here. I think the solution, right, because Schrödinger's cat is neither alive nor dead until you open the box. But the observer has to not move or stop. So maybe that's me. Okay, so I have to be in a quantum state, which means you can't look at me, because then you'll collapse the waveform. Don't look at me through the rest of this thing. Got it? Okay, great. Dash 122-12. Completely cranial nerve. So, I'm going to do the complete cranial nerve exam, but with those numbers in mind. So first thing, cranial nerve 1 is smell. So I brought you some tea to smell. I know, very tingly sounding. I know it's extremely tingly sounding. I said, I know you can't hear me when I rustle anything because there's something wrong with your ears. Go ahead and sniff this and tell me what it is and what region it's from. Okay, so your optic nerve is normal. Not to the level that I would like it to be, just normal. Not your optic nerve, I'm sorry. Look, Google Translate has me a little confused, but I'll adapt. I meant your olfactory. Cranial nerve 1 is your olfactory nerve. Alright, so here's my notes about that. So it says 122-12. So I think that means I'm only supposed to do cranial nerves 1, 2, then 2 again, then 12. And it says completely cranial nerve. So that's what we're doing. So we just did 1, which I've never done in normal practice because your sense of smell is not usually so applicable, even though it can be an early sign of various brain diseases, but usually you will say that, or brain trauma. It's not something that's usually tested. 2. So 2 is your vision. So let's do a vision check. What's this say? What's this letter? And this letter? And this letter? And that letter? What's this number? And that one? And what's this letter? Excellent. What's this word? about that word? Can you see that? Nice. Okay, and then we'll do 2 again. So we'll do it this way. Can you do me a favor? We're about 3 to 5 feet away. By the way, they found that this is not as helpful. Doing a hand chart like this is not as helpful as doing a Snellen chart on the wall, actually. They found it's more inconsistent. However, it still helps us to identify grossly normal. Can you read the middle paragraph for me? It says cervical spine clearance. Can you read the small print? It says reliable patient, which you are not. You are not a reliable patient because you are a camera. And then we have to do 12. We've done 1, 2, 2, and now we have to do 12. So, go ahead and stick out your tongue and move it back and forth for me, just like this. All right. And that's the complete cranial nerve exam according to Google. It's just 1, 2, 2, and 12. We don't have to do the rest. So examination of the right cerebellum. Major changes in the little finger, shin, and elbow joints of the nose without disc. So, and only the right cerebellum, which means that I should only be looking... Do the nerves cross over? I don't think that column crosses over, so that means I should only be looking at your... Oh no, they do cross over because it's the motor. So I need to be looking at your left side only. So, because we only examined the right cerebellum according to this. So I'm going to look for major changes in your little finger. Alright, give me your little finger on your left side only. Which is over here. Yep, because your right is over here. So left side only. I just want to see you do this. And I want you to touch your nose and then touch my finger. With only the little pinky. We don't care about the other hand. The other stuff. Okay, and do it again. And again. And again. Okay, perfect. And then we need to look at the shin. So go ahead and do me a favor and run your foot from your... how are we going to only do the shin without also doing the ankle? Flex your shin for me. Oh yeah, baby, that's a nice shin. Alright. And the elbow joints of the nose. I didn't know you had elbow joints in your nose. Take a look here. Let me see. I'm going to investigate more closely. I'm going to get some gloves on because I didn't even know about the elbow joints of the nose. They didn't teach us this in medical school. It just goes to show. You can't trust everything you hear. I'm excited to look at the elbow joints of your nose. Alright, let's take a look. I'm not sure exactly what I'm looking for here. I feel like that's a little high. That's like between your eyes, but maybe the elbow joint of the nose is where the joint between the bone and the forehead is. So I'm gonna go a little high. I'm gonna be right like on your forehead and try to pull your skin and see if that way I can see any better. I've never seen the elbow joint of the nose before, so I'm gonna have to really, really work for this. Just really see the elbow joint of your nose. Just really look. I guess it could be down here. What if up in? I guess no. I think it's the bridge. I think that's the elbow joint of the nose. Can you wrinkle your forehead for me? Because since we're testing the cerebellum and the elbow joints of the nose, and we have to do it without a disc, so no discs. Do you understand? Let me see if there's any discs we need to take off. I don't know. I'm just pinching your skin there. Okay. No discs, huh? Alright. Wrinkle the elbow joint of your nose, please. Perfect. And that's the only cerebellum we have to do. Wide range of strength and softness in both pounds. Which pounds are we going to check of yours? Because I'm sure you have many. You have at least 180 right here. All right, so let's make sure we have a wide range of strength and softness in both pounds. I'm going to pick a pound on your forearm here and a pound on your knee over here. Yeah, because it's nice and easy. All right, so a pound on your forearm here. Let's see. I want a wide range of strength. Can you push up against my arm? All right, and then I want you to push very gently against my arm. Nice. And your knee over here, can you push up really, really hard and strong? You can be stronger than that. Ooh, nice. All right, and then very gently. I don't want to even feel your knee there. That was a pretty wide range of strength. You were pretty weak then. Yeah. How about softness in both pounds? I'm going to examine you for softness. Well, I think that softness is kind of related to squishiness. What do you think? No? Well, I'm going to squeeze and then I'm going to pat, and that's how we're going to determine softness. So on this side, okay, and then I'm going to pat. Okay, and on this side, I'm going to squeeze this on your knee. And then I'm going to pat. You know, to tell you the truth, your knee is not very soft. It's a little bit hairy. So I guess that's a bad sign. But there should be a wide range of softness. So you should also be able to make it hard. Can you make your knee was hard already. Can you make it soft? I'm going to try again. And then over here on this forearm. I didn't really see a range in softness. It was pretty much the same both times, so I guess that's concerning. Now we need to establish strength and normal thinking in your feet. This is clearly emotional strength since it's related to normal thinking. So let's have a conversation. What are your feet thinking about? That doesn't seem normal. I think you need to correct those thoughts. Try again. What are your feet thinking about now? This would be better with you're absolutely right. Right with this instead. Nice. How about the strength of character? If your feet were in a tough situation, would they compromise their ideals or would they stand up for what they believe? I see. Yeah, that's concerning. Alright, the thumb test, L5, is normal. I was taught that L5 is best tested in the lower extremities because it's your lower back, but we're going to use the thumb instead because Google is always right. So give me your thumb and push up. Nice. The thumb test is normal. General tremors, motility, and proprioception. Can you tremor for me? All right. And then move all your limbs. Good. Now proprioception is a fun one. We can test that by me moving all your limbs. So close your eyes. All right. And am I moving your hand up or down? All right. How about now? Perfect. How about your arm? Am I moving your arm up or down? Perfect. All right, other side. Am I moving your hand up or down? Okay. And again. And the arm now. Okay. And right. How about your foot? I'm going to kind of reach down here and lift up your foot, okay? Or down. One of the two. And you got to tell me if I'm lifting it up or down. Ready? That I know, that's proprioception. WNLDTR. Oh, that a thing I know was normal. You know, it's all your tendon reflexes. So the first reflex we have to check is your wall muscle. Oh, well, I'll check on the wall right here and check the reflexes on the wall. That's easy enough. The wall has no reflexes. All right. Why am I getting slime all over me? Here, you can have that slime. I think it's from your ear exam last time. And then your popliteal tendon. Usually I would check your patellar tendon because that's what I learned in medical school. But Google says popliteal tendon, so I'm going to go around to the back of your knee and just check that tendon instead. Okay? And I'm not sure how to interpret that result. But I'll write it down and think about it. And then skeletal muscle. Now, in medical school, we were taught that there's, you know, 3 major kinds of muscle. There's smooth muscle, which is what's in your bowels and your blood vessels. There's cardiac muscle, which is kind of in between smooth muscle, and skeletal muscle, which is all the muscles, you know, on the outside of your skeleton, pretty much. It's the kind of striated muscle that helps you to move around. So I need to check your skeletal muscle reflexes, which is... well, what does that mean? All your skeletal muscle. It says only one, so there's one skeletal muscle that I have to check. What do you think? Which muscle is it? Well, take a guess. Usually you don't check muscle reflexes. Usually you're checking on a tendon, because that's where you get those good trigger points. They do say to check the triceps and the Achilles tendon distance. So I know how to check the triceps, that's easy, and then we'll pick a skeletal muscle to check. I pick the skeletal muscle that moves your eyeball. Not your eyeball, your this thing. We're gonna check that one. Yeah, your eyelid. Yeah, ready? Yeah, it worked, you blinked. All right, and here. Excellent. Your skeletal muscle is fantastic. Let me check your triceps. Give me your arm here. All right. Same thing over here. Lift up your arm. That I know how to do. And then we have to check your Achilles tendon distance. So I'm going to go ahead and measure your Achilles tendon. Are you ready? So when I was very briefly working in OB, I learned how to measure cervixes using my fingers. My fingers are small, so this is about 1.5 centimeters, 2 centimeters of dilation, and this is 10. So I'm going to measure your Achilles tendon just as if it was a cervix. Wow, your Achilles tendon is really long. Okay. And then we add 2 plus 2, which is absolutely excellent. Well done. All right, Babinski and Huffman regularly. I don't know what the Huffman is, because that's not a thing, but the Babinski I do know. So I'm going to tickle your foot. I'm going to take this and rub it along the side of your foot. It's not comfortable, and I'm going to see how your foot responds. And that's a way to check things like brain damage and stuff like that. Okay, down here on your foot. Oh, yeah, that's a little ticklish and uncomfortable, isn't it? Okay, and again. Perfect. All right. And you're supposed to respond differently as an infant than you do as an adult. Yep. And then normal Romberg. I know how to do that. Walking, normal, and normal walking. So let me have you stand up. Put your arms out in front of you and close your eyes. Okay. And I'm going to gently push you, but I'm not going to let you fall. Perfect. Alright, that's a normal Romberg. Okay, and then I want to see you walk, and I want to see your normal and your normal walk. Both kinds. Excellent. And lastly, keep your feet at 0 degrees while traveling. So this means you can't really lift them up from the floor. You're going to have to shuffle. Okay, let me see that. All right, and that's how you're going to need to walk from now on. You're going to need to do like that. Well, Google Translate, Dr. Google said. All right, well, shuffle on out of here, buddy. It's been lovely having you. It always is. Thank you very much for spending some time with me. And don't be a stranger now. I'm sure, since it's gonna be great. We're gonna have a good time. I agree. I think so. All right. Have a lovely evening.